Visitors to the U.S. comparing medical insurance often ask, what is pre-existing condition coverage and what happens when an emergency occurs? Let's look at a typical situation. For example, have you had a heart attack in the past? Perhaps you have current medications for diabetes or high blood pressure. If this is the case, coverage for emergencies related to these conditions is available. What makes pre-existing condition coverage so important? As a visitor to the U.S., it's important to understand that accidents and medical emergencies may occur. Should they occur, the insured is most concerned that a claim is paid. How is this process determined? Every medical plan has three components: an administrator, underwriter, and a claims processor. Historically and currently, most underwriters do not offer pre-existing condition coverage because of the high costs and potential losses. India Network was the first administrator offering pre-existing coverage with its large customer base and lower overhead. It continues to lead the industry with the highest coverage and minimal exclusions. Pre-existing condition coverage from India Network will cover any emergency related to a pre-existing condition. It needs to be acted on within 24 hours, where the emergency could result in death or a serious impairment of bodily function or organ. What would be excluded? A scheduled visit or maintenance of a pre-existing condition for lab work or medicine. There is a 7-day waiting period for anyone enrolling after their arrival in the host country. After the 7 days, which is restricted to accidents, coverage is in full force, including emergencies related to a pre-existing condition. India Network plans differ from other companies offering pre-existing coverage in a number of key points, primarily around the word reoccurrence. Other companies will want you to have first had a heart attack before covering a new heart attack. That would be a reoccurrence. Other differences that could result in a claim not being paid include a look-back time period, or the insured has high blood pressure, diabetes, or current medications. Those 60 and older are very often not even eligible for pre-existing condition coverage. If pre-existing condition coverage is not selected and the insured has a pre-existing condition, if an emergency related to the pre-existing condition occurs, there is no coverage. In a second situation, the insured may feel they are in good shape, yet, as an example, a heart attack occurs. There will be a cap on that emergency. The insured will not be paid to the policy maximum. As we consider what occurs when pre-existing coverage is not selected, with India Network Health Insurance, if one of these 5 types of emergencies occur, such as a cardiovascular accident, and the emergency is determined not to be related to any pre-existing condition, there will be a cap based on the policy selected, ranging from $0 up to $7,500. As previously stated, if the emergency is determined to be related to a pre-existing condition, there is no coverage. What happens if pre-existing condition coverage is selected? If the insured has a pre-existing condition that causes an emergency, there will be a policy maximum reimbursement. If one of the 5 specific types of emergencies, such as a heart attack, occurs, and the individual has no pre-existing conditions, instead of being capped, coverage will be made available to the policy maximum. When pre-existing coverage is elected, India Network will not only provide medical evacuation and repatriation benefits, but will also cover numerous services shown below to help stabilize the patient, from the ambulance and emergency room to surgery and hospitalization. India Network wants to simplify the process for selecting a plan. Use Easy Select from the homepage of India Network Health Insurance. Look for the Instant Quote button. Choose the age group with pre-existing conditions. Then take time to read the choices, especially look at the best deal, most popular, and the best tip. Compare premiums, deductibles, and coverage to maximize your benefits. Thank you for taking time to better understand pre-existing condition coverage. when selecting visitor health insurance. To learn more, go to IndiaNetworkHealthInsurance.com or call 877-204-0222 to speak with an agent.